Every doctor, symphony conductor, or race car driver knows that success in medicine, music, or NASCAR racing requires hundreds of steps. Physicians also know they must avoid dozens of behaviors so that every patient can have a positive experience. In the past, I have discussed habits of top-performing doctors in maintaining the loyalty of existing patients and in attracting new patients. Conversely, this is the first of a two-part video on 10 behaviors that should be avoided whenever possible. I call these never-evers. Never-ever number 1. Never turn your back on your patients in the examination room. Doctor-patient communication is enhanced when they are eyeball to eyeball, not when one is looking at a paper chart or a computer screen. Whenever possible, there should be no barriers between doctor and patient. Eye contact establishes trust and a bond with patients and allows physicians to be able to read body language. This slide shows one kind of computer barrier to avoid, and the next slide shows a preferable arrangement where the doctor can look at both a computer screen and the patient. Never ever number 2. Never put your hand on the doorknob of the examination room when speaking to a patient. This action suggests to a patient that you will leave the room before he or she has a chance to respond to anything you say, notably to ask for clarification. Instead, I offer a very simple alternative. Before standing up to leave the exam room, ask the patient, "Have I answered all of your questions today?" Or you can simply ask, "Anything else?" Never ever number 3. Never allow pharmaceutical reps access to the practice when you're seeing patients. What message are you sending to patients who have been patiently waiting in your reception area when someone with a briefcase walks to the front office and asks to see the physician and then is escorted into the doctor's inner sanctum? The message is loud and clear. The pharmaceutical representative or the salesperson is more important than the patients. Patients deserve first priority, and you should see pharmaceutical representatives before or after all your patient appointments. Never ever number 4. Never make patients use a phone tree. Telephone trees are anything but user-friendly. Also avoid forwarding the phone to an answering service during lunch hour. Patients often use the lunch hour to reach a practice during their workday, and you want to be available to your patients during the noon hour. In my practice, I arrange for each employee to take one day to eat at her desk and answer the phone during the lunch hour. Lastly, never ever number 5. Never fail to update your website regularly. Internet search engines look at every website for frequency of content updates. If you want to rank high on Google searches, that is, to appear on the first page of Google for search terms relevant to your specialty and your practice location, then you have to contribute new content often. Personally speaking, my goal is to add new website material at least every 2 weeks. Of course, I recognize that most physicians, including myself, are far too busy to create content on a regular basis on their own. I suggest you outsource this to a firm or content manager that does this for your practice and creates content that will land you on the first page of Google. Avoiding these mistakes and blunders will not only guarantee a robust, healthy practice, but will also ensure an enjoyable practice appreciated by all patients who interact with the doctors and the staff.